Very good morning, students. I hope you are all doing good and we are fine. Today we are going to discuss the renal function test. First, we need to know what is the renal function test, why we have to do, how we can manage our renal system. The renal function test is also known as kidney function test. We know the kidney play a major role in our systems to excrete the wastes. Not only that, in other things also. Normally, the renal function test, how they are performing, means a series of blood or urine test that assess how well your kidneys are working. That's why we need to know the kidney function test. Kidney function test. Okay. Next. In our classes, we are going to, these are the contents listed here. We are going to through the way. First, we need to know the renal function test, the introductions. Then, what are the main functions the kidney is actually doing? Third, what are the components in the urine test, like how much urine volume, color, pH, and specific gravity. Then the order also. Then particularly, we need to look into each and every part of the test, like the glomerular function test. Then creatinine pigment clearance test. Then tubular functions, how our tubules are working. Then how much the urine dilution is there. Later we are going for urine acidification. Then phenol sulfaphthalate test. First we need to know here in the slides we are looking kidney, under there one of the major functional compounds is called as nephron. So in kidney is the overall structure, inside the nephron is there. That nephron is playing the huge role in our excretion as well as the filtering of our molecules inside our human systems. What are the main functions the kidneys are doing means, first the waste elimination. How much we are ate, all the things is absorbed by inner tubules. Then later the components is reach kidney. There the further the secondary absorption will take place. There later only the unusable things will become a waste. Next is detoxifications. In any toxins is present in our body, it will be detoxified, whether through coming through this one, even food and whatever the medicines we are taking. There if any toxin is there, it need to be cleared. Then water balance in our human body, how much water content is needed is already you know. So how it will be maintained, our water balance in our human body. The fourth is filtration of the blood. And fifth, metabolism of vitamin D, then regulation of electrolytes, then the regulation of blood pressure. So these are the main functions our kidneys are actually doing in our systems. Then how we can keep our kidney health? First we need to be stay hydrated. Stay hydrated means we need to take water. We need to take water in the frequent times. Annually, for example, in a day we have to take at least 2.5 liters of the water. Then only we feel the hydrated. Otherwise, when the water uptake is going low or going high, also influence the renal functions. That's why we need to stay hydrated. The next, eat balanced diets. Balanced diet means the minerals and fiber rich foods we need to be take, and most importantly in the timely we have to take it. Third, exercise regularly. It will help to function our organs in well manner as well as it regulate our body metabolisms. Fourth is avoid smoking or alcohol consumptions. It will directly influence our renal functions. Fourth, get regular checkups. In frequent time manner, we need to check our kidney functions as well as in human body checkups. The later, here we are seeing What exactly the kidneys functions? First one is the excretion of waste products. We already discussed about that. The waste product means the metabolic waste. So when our body is carry out some metabolic reactions, it will always remove certain type of things to as a waste, because we could not be accumulate. It means reaccumulate in our body. Example, urea or creatinine as well as the uric acids. While doing the urination, it automatically this urea as well as uric acids will go away as a waste. Second, the maintenance hemostasis. Hemostasis means the water and electrolyte balance in our body. It will help with the help of our hormonal systems. Then acid base balance, it will help to reabsorb the materials through kidneys. Then fourth is hormonal functions. When our renal systems will infect in some circumstances, it always influence our hormonal functions too. So we need to know about that. Then here already told the kidneys functional compound is nephron. We always call it the functional unit of the kidney. It have the two components mainly. One is glomerular apparatus. Generally, it is a filtration unit. Then second is tubular systems. It is selective reabsorptions. After our food materials absorbed through all the way, it finally reach to kidneys or what to say the excretion systems. There, it go for again for reabsorptions. That reabsorption takes place in the tubular systems of our kidney. Then this renal function test is used to access our glomerular as well as tubular. It means the function filtration units as well as reabsorption unit, for which blood or urine samples we used. Next, so first in the renal function test, first we need to check up the urine value. How much urine per person per day is excrete. It depends upon one of the main reason is water uptake. How much he used to take the water. If 2.5 liters per day value means we have to take at least 2 liters around water. It may differ by summer as well as the winter seasons, because winter season always we could not excrete more water by any other means. Only we need to excrete the water contents through the urination only. So that time person's uptake of water content is less. In summer we used to take lot of water. It means around 2.5 liter means we have to take 3.5 liters up to, because the excretion of water is going by sweat also. Okay, but the genuinely per day 2.5 liters to 3.5 liters the water we need to take. Among that, the urination have to take place up to 2 to 2.5 liters. If some person is having more urination means he already infected with some chronic diseases like diabetes mellitus, because generally we know in every homes nowadays diabetic mellitus affected patients or there, our elders, so they need to go again and again for the urination purpose. So that is the unusual way that we called as polyuria. It means over removal of water by urination. Okay, first we need to measure in 24 hours how much water he have taken and how much amount of urination took place. This, if sometimes if we are taking only to 1.5 liters but we are going around more means, what will happen? The body will be dehydrated. It means hydrated. Excess removal of water content also will influence our renal filtration systems. When our renal system, kidney systems will not function as proper way, it means the filtration as well as the reabsorption capability, when we lose our kidneys, automatically this kind of things is came across in every patient's life. Okay, next one is color of the urine. Normally every urine may come is pale yellow, is slightly yellow as well as amber color, because if it is in some cases like the hematuria or hemoglobinuria, they produce a dark color when the patient's urine is come across with that oxygen, automatically that the urine become a dark. That is the different cases. But it is normally slightly yellow is the vibrant, it is the normal color, because in everyday morning the first urine when took place, that time the pale yellow might be. Then later when we continuously taking the water in frequent times, automatically the urine color will be changed, it will become a transparent one. That is the normal case. But when the patient is affected with the diabetes mellitus, always their urine will become a thick, it is a turbid manner as well as dark yellow. If dark yellow means the tubular dysfunction is there, like the reabsorption capability of that renal systems is failed. That is the symptoms. Then pH of the urine, usually the pH around 6, but when the person is infected with the urinary infections, their pH might be 4.52, or it means what, acidic to alkaline conditions. Then specific gravity, it varies from 1.016 to 1.025. Then the odor, the smell, the foul smell. If that someone urine is getting the foul smell, it means the bad smell. That unbearable smell is come across, they may infected with some bacterial infections. Third is the test for glomerular functions. Already I told that glomerular functions. Actually, the glomerular function, why we need to be test means in the urine samples, it have the color, it have the pH, it have the odor. The next one is protein. When our body metabolisms, after metabolic activity, it excretes a lot of unwanted things. In the nephrons, it will reabsorb the things. Quite any useful things is there or not. If it is usable, it will reabsorb, then it remove as a excretion of the urine. When the tubular function is affected, what will happen? After metabolic activity of our body, some proteins will become to come there, that will not be reabsorbed. So it always excreted through the urine. So that indicates that our nephrons glomerular function is affected. Whenever urine samples having proteinase substance, we can say our nephrons tubular function is somewhat affected. Okay, normally the urinary excretions, we have that albumin. That albumin means albumin is less than 30 mg per 24 hours. In some cases, the protein, the albumin excretion is more than 30 to 99 mg. It is detected as that the microalbuminuria. We call this microalbuminuria or paucialbuminuria. It means excess amount of proteinaceous albumin is in the urine systems. So it indicates the glomerular function is affected. Then fourth one is creatinine clearance tests. Creatinine is a kind of pigment is present in the urine. This denote that the volume of the plasma, how much the plasma components is excreted through the urine. Okay, that is the creatinine clearance test. Normally the rate of excretion of the creatinine is also metabolic waste. Okay, in the 24 hours, the urinary concentration and plasma creatinine concentration we need to be measured. That time we can get to know whether our urine containing creatinine pigments above the level of the normal cases. So normally in 75 to 125 ml per minute we need to be. In women's case is 65 to 115 ml. When that the renal dysfunction decreased, this indicates that glomerular filtration rate. The next is tubular function test, the urine concentration, how much the turbidity of that urine or specific gravity of the urine. It also will get measured through the tubular function test. Here we can assess that hormonal influence of the urine. In the urine samples we can analyze how much hormonal release also there. That is the tubular function test. Then the urine dilution test, how much the urine is turbid. turbid means somewhat quite thick. Okay, in that the dilution rate means the urine is too thick in that conditions. For example, if what to say, if 1200 ml of water is given, what will happen? The urinary specific gravity should fall in 1 to 1.005. Osmolarity is 100 mass ml per kg. Sometimes that after 1.2 1200 ml of water is uptaken, urine specimen is collected in hourly next 4 hours, then we can assess how much the urine dilution is there. Actually, how much urine is left out. Okay, it will help to assess the renal tubular disease. It also indirect the specific gravity of the urine also we need to be measured. Then urine acidification test. It's we already say that about that pH. Isn't right? Yes, the normal pH is 6. When it goes for below 6, it's automatically we can say in our urine having in that acidifications. So we need to measure by urine acidification. That with that we can know how much pH of our in the urine. The last one is phenol sulfatylene test. This test is indicates that the renal excretory function. It means impaired renal excretory functions we can measure. For example, in the patients we can giving half liter of water initially. What will happen? In the test after 15 minutes we can collect that urine and we can measure it. It means 15, 30, 60, 120 minutes in the time interval. In serially we have to collect their urine and we can assess it. Through that we can measure that the renal excretory function is quite normal or abnormal. Okay, these are the things of the renal function test, and thank you very much.